I'm Dr. Andrea Pinac. I've been in Opelousas since 1985. I trained at the LSU School of Medicine in New Orleans, did residency at the LSU affiliated hospitals, which I finished in 1985, and I've been practicing obstetrics gynecology in the greater St. Landry, Opelousas area since that time. There are many advantages to the robotic hysterectomy other than the conventional types, mainly recovery, as well as the technique of doing it itself. The recovery, to be honest, when they first came to me and explained robotics, I thought they were lying to me. I didn't believe it. I told them I didn't believe it, but it's proven to be correct. Patients don't hurt. When I see them the afternoon after the surgery, they actually look better than me. I'm not sure which one of us had the surgery. They're walking, they're usually up, moving. Pain medicine, they usually take very minimal, if at all. The time is cut in half, the recovery is much quicker. You get back to your normal life much quicker. And it is still a major surgery, you can't discount that, but the recovery is much, much less. And the advantage of doing many more procedures that you couldn't do without a big incision that you can now do. Well, the indications for hysterectomy are very varied, anything from bleeding, fibroids, pain, infection, the list is very long. Robotics allow you to have actual direct visualization of the pelvic tissue, which you can't see from a vaginal without having to have the big incision. It's called minimally invasive because it's usually 4 very small incisions. They don't open, they can't break down, and because of the nature of the robot, they lock, they don't move, the pain is much less. So the indications for hysterectomy are pretty much the same, but it's the procedure, the way it's done, and the recovery that's much better. During robotic surgery, of course, the patient is brought into the operating room as usual, and then of course we have the most advanced robot in Acadiana. We were the first to get this particular one. Other hospitals have since caught up to us, but we have been the first ones, the innovators with this particular robot, which is the current most advanced robot. The surgeon does the procedure. It's not like you say, robot do hysterectomy. You stand there, you have the robotic hands that I control from the console, and then I actually do the procedure, and it's removed vaginally. So it's actually still a vaginal hysterectomy. There's no big incision, it's not an abdominal hysterectomy. It's just called a DaVinci assisted, where that is done from above to allow you to do many procedures vaginally, which you may not otherwise be able to do. When you have a robotics, that's one of the huge advantages of the robotics is instead of 2 days in the hospital, it's one. The day you have surgery, you're up that afternoon eating, moving, disconnected from IVs and Foley's in the bladder. Then you go home the next morning. Then instead of 2 weeks, things like light housework, it's 1. Instead of 4 weeks for driving, it's 2. And it's full release in 4 weeks for everything instead of 6. The robot is a very advanced system, which is something that we have had this advanced system longer than any other hospital in Acadiana. It is the most technically advanced machine in the hospital, and it allows many procedures, not just gynecological, which I use it for, but other aspects too, which are minimally invasive, and a huge advance that we have here ahead of other hospitals with more experienced surgeons who use it more than they do.